Hello everyone, I am Dr. Jigyasha Sinha, Consultant Paediatric Neurologist at Narayana Hospital, RN Tagore Hospital, Mukundapur, Kolkata. I will be talking to you about headache in children. Many of the parents are quite anxious to learn about the headache in their child. This is because they fear about the brain tumor in the child. Less than 3% of the headaches in children account for brain tumor. The rest are because of many other reasons like just a viral infection, cough, cold, influenza, or having just a head injury, sinus infections, etc. can lead to this. Different types of headache in children are tension type, migraine, cluster headache, etc. Tension type headache is one of the most common headaches in children. About 25% of these headaches are seen in the early childhood and 75% of these headaches are seen in the adolescent age group. When a child complains about the headache, we should always ask him or her about the location of the headache. The location, the duration, the intensity can actually give us the clue to the type of headache. Along with this, there are certain other symptoms which can be associated with the headache, like having a very high sensitivity to bright light or loud sound. Certain other associated symptoms like having nausea or sometimes even vomiting, blurring of vision, all these can also be associated and can give us the clue to the severity of the headache also. A family history of headache is again very important, especially in cases of migraine or cluster type headache. When you identify a child to be having headache, one should always notice whether the headache has been so crippling that the child has been missing out on school or on daily routine activities or not, because accordingly the headache treatment can be decided. If you ask about the investigation of headache, usually a CT scan or MRI brain can give us a clue whether there is any acute condition existing for the cause of the headache or not. And rarely an angiogram or a venogram may be needed depending on the type of headache. Additionally, certain blood investigations has to be looked into. The treatment of headache is mainly or primarily based on the lifestyle modification. But apart from this, there could be certain medications which may be needed for the type of headache that the child is having. Certain drugs, also known as anti-migraine preventive measures, can be given even to a child. In the treatment also, after certain medications, it is very important to have or maintain a headache diary. We should note down the day and the timing of headache, because that can help us decide how aggressive we have to go in terms of treatment. Lifestyle modification plays a vital role in having a child headache free. In the lifestyle modification, it is very important to note that the child should stick to a good diet, healthy diet, avoiding junk food, packeted food. Second, a child should also have a good sleep in the night. Late night sleep should be avoided. Screen time should be restricted and reduced. Certain exercises can be followed, and identifying certain triggering food or environmental factors for headache can also be helpful. Apart from this, remember that the child should always have a good morning breakfast before going to school, because an empty stomach itself can cause a trigger to the headache. There are certain red flags to headache which has to be identified in your child and acted upon urgently. In this, any worsening kind of headache, suppose the child is having a headache already and there is a sudden worsening of the headache, or it is making the child get up from sleep and not making him have a good night's sleep, then that amounts to a red flag. Apart from that, any kind of behavioral change in your child or blurring of vision should be looked into and should be urgently catered to. To conclude, 50% of the headache symptoms can just go away with lifestyle modification. So maintain a healthy lifestyle in your child in order to prevent him from having future headaches. Thank you very much.